bum 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 ba-dum bum 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 ba-da-da-dum bum bum ba-dum ba-ba-dum bum 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 ba-dum bum 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 ba-da-da-dum bum bum ba-dum ba-ba-dum. Hi, friends. Hello. A hearty hello and hi-ho, Silver. That only goes to show my age, right? So glad you're all here, my friends. It's Monday night, and it's Monday night at 8 o'clock Eastern Time, and we do one thing and one thing only at this time, and we talk about homeopathy. I teach you what I know or what I hope I've gained in these years of doing this. My name is Joette Calabrese, and that's what we do on Monday nights. And for those of you who already know me, welcome, my dear friends. It's always great to see you. I see you coming in. How is the sound? I have sound. Yes. Yeah, everybody's got sound. One person doesn't. Might want to just check your settings because everyone else is okay. Everyone's got sound. Great. Very, very good. So, this is an interesting topic tonight. It's something that I've dealt with, not personally, but as a practitioner with clients. And a couple of students have reported it to me as well, but mostly with clients, one family member, and I want to share it with you. Now, for those of you who've been with me for some time, you may know, pretty much what I would do homeopathically for this concern. And what we're going to talk about tonight is cognitive change after surgery. And what's strange about this is that it happens very frequently. Well, maybe I shouldn't say far too frequently. Let's put it that way. I don't want to say very frequently. I don't have numbers. I don't have studies. I just have my own experience, and it's happened a number of times. And so given the number of people that I work with or have worked with through the decade, through the years, I have to say that I think it's pretty darned more common than we think. Now, it may not be as severe as loss of cognitive ability or even permanent cognitive ability, but it can be aspects of it. And so I want to share some of this information that I have kind of put together myself. This is kind of, I'm thinking this is kind of atomic in a way. It's kind of the kernel of the condition, the kernel of the problem. And so, as you may or may not know, in homeopathy, it is sometimes useful to know the exciting cause. Not always, but sometimes it's very useful. We can then hang our hat on that exciting cause. And that means that if someone has cognitive decline after a head injury, then we would say that we're going to go after the head injury, plus the symptoms that the person is suffering from, regardless of how the head injury occurred, and it's different in different people often. So we're not going to be talking about protocols tonight. We're going to be talking because people react differently to this particular situation, especially the elderly. And with the elderly, we often use the same medicines time and again for cognitive decline, whether it's as a result of local anesthesia, general anesthesia, or anything close to that. It's the problem here is that we often let me just get to the bottom of this atomic idea. We are being infantilized as adults. We are told that we must act a certain way. We must do as we're told. And I am not going here to tell you that you should never listen to your surgeon. Far be it from me to say that, because there are times when surgery is warranted and valued. But I think surgery is used far, far too frequently. So we must question. Now, it doesn't mean you question the doctor, because if you want this doctor to be on your team, you might want to say, thank you very much, doc, and then go on and do your research, going for a second or third opinion, etc. Jordan Peterson, one of the great thinkers of our time, said, too afraid to say no is not healthy. Make yourself competent and dangerous. Now, we don't mean danger in the colloquial meaning. We mean dangerous in that you have strength. He says dangerous is the opposite of being weak. You should be capable of threatening someone. Those who have swords and keep them sheathed will inherit the world. So it's only, you're just protecting. That's all you're doing. You're not drawing it out of the sheath. If you're not a formidable force, he continues, then there's no morality in your self-control. What a philosopher he is. So another way of saying it, more colloquial, a more colloquial method or way would be to say, you got to have guts, spunk, and moxie, my friends. You have to know when to say no. You have to perhaps say, could we postpone this potentially? And then you look into other methods, homeopathy, change the diet, change the environment, perhaps put it off, see what comes of it. So, okay, Andiamo, let's get going on this. Let's start with here. I've got some information I want to remind you of. For those of you who are new, this might not be a reminder. It might be something that's brand new to you. Let's start with this, that the body was not built to process synthetic drugs. It's only in the last 50 years. Okay, maybe 100? The brain was not built to be able to handle psychotropics. Psychotropic drugs are fairly new, my friends. The liver was not built to drink alcohol. What can I say? I love a good drink. Don't do it much anymore. I'll take a sip here and there. Nor is the body capable of eating just about anything. And so what we put into our body, on our body, definitely matters. So we got a couple ways to look at this. Remember Sir William Osler, MD? He was one of the founders of Johns Hopkins. He said, the man who takes drugs must recover twice. Once from the disease and once from the drug. Yeah, it's a choice, my friends. And what we do on a day-to-day basis matters, micro choices. And when you put together, if you were ever to put a timeline together of all of your sufferings, the conditions that you've had and what they were met with, what drug, what procedures, what tests, what surgical procedures, whatever, put that all together, you might be flabbergasted. It's pretty amazing how much we have submitted to. Now, let me also say that there's another aspect to this, and I have this written in my kitchen in a little card that says, we dig our graves with our forks and knives. And I didn't know who that was attributed to, and it turns out it's also Sir William Osler, MD. So it's not just food, obviously. It's what we allow, what we put into our mouths on a day-to-day basis, that birth control pill every day. Every day. For years. It's every single day. What we put into our mouths every day matters. What's injected into our veins matters. What we subject ourselves to in x-rays, sonograms, etc. all matter. And for those naysayers, I say now. Miss Brittle Britches, because I know I'm going to get a lot of people who say, maybe not today, maybe not tonight, but I will hear from people who say, thank God for modern medicine and surgery. Well, in certain circumstances, that's absolutely so. So let's get to what we talk about tonight. what we talk about every Monday night, and that's homeopathy. And let me take a sip from my water. Yes, Dr. Peterson does need homeopathy desperately right now. I wish we could get to him. I mean, I suppose if anyone knows him, get to him. He's been through a lot. All righty, now let's talk about homeopathy. Starting with our great leader, Dr. Samuel Hahnemann, who put together the organon, or at least started it. The first edition was in 1810. Of course, he was working on it from the late 1700s. And then the last edition was written in 1833. And then the last edition, actually 1842, excuse me. And then it wasn't published until the 20th century. And what he said time and again in many different ways was suppression occurs when treatments, allopathic, conventional, or external, removing visible symptoms without addressing the underlying dynamic disturbance of the vital force, driving the disease deeper and creating worse, more complex chronic conditions. True cure requires removing the totality of symptoms, allowing the vital force to restore order internally and externally. He explicitly condemns these methods, especially surgery, as harmful and even criminal. There are exceptions, obviously. Surgery is needed at certain times. Let's say kidney stones. Yes, I can see that. We would use homeopathy first. We would try to do that, certainly. But if it must be done, that is not suppressing by removing stones. By repairing a broken bone, not suppressing. He goes on to say every external treatment of such local symptoms, these are local symptoms, whatever it is that's going on, that the goal of the surgery is intended to change, the object of which is to remove them from the surface of the body while the internal disease is left uncured. As for instance, driving off the skin the psoriatic eruption by all sorts of ointments, burning away the chancre by caustics, and destroying the condylomata on their seat by the knife, the ligature, or the actual cautery. This pernicious external mode of treatment has been the most prolific source of all the innumerable named or unnamed chronic maladies under which mankind groans. It is one of the most criminal procedures the medical world can be guilty of. So you're getting the point. I could keep reading. There's a lot more here. There's a lot of great information here in the organon. Surgery is suppression. So he approved of surgery for, as I said, true external trauma or mechanical issues, removing foreign bodies, setting broken bones, ligating arteries, opening imperforate anus, crushing bladder stones, etc. These are not dynamic diseases, but physical lesions requiring mechanical surgical removal. But if it is deeper than that, warts, tumors, etc., ulcers, surgical removal is suppressive and iatrogenic. If you don't know that word, I know many of you do, but if you don't know, it means iatrogenic means disease caused by modern or medicine, drugs, surgical procedures, diseases that are caused by the medical profession. And it creates deeper, harder to cure chronic diseases by removing the guiding principal symptom. In short, Hahnemann viewed surgical removal of local disease manifestations without internal antimiasmatic treatment as one of the greatest errors in medicine. So, now let's talk about what comes of these surgeries. Not only are we potentially suppressing a condition, driving it to a deeper state, and considering it, as Hahnemann would have said, downright criminal. Let's talk about this newly named condition. It's fairly newly named. There's not a lot of discussion about it. There's not a lot of warning from the medical team to the patient or from the medical team to the patient's family. And I say family too because this is what happens with these anesthesias is so prevalent in the elderly that is really where the seat of this discussion should lie. Now, I don't want you to think for 1 minute, my friends, that it's only under general anesthesia. Local anesthesia can also cause this problem. And we see that in the dental chair. I'm going to give you an example of that. Years ago, I had a mom come to me. I'd been seeing her daughter for, I think it was food intolerances. It had to have been 15, 20 years ago. Probably 20, more like 20 years ago. And she went to the dentist and she got a local anesthetic. And when she came out of the chair, she was about 13 years old. She had regressed to about 5 or 6 years old. She had regressed to baby talk. She lost some vocabulary. She acted very childlike. She had no interest in the interests that she had at that time as a 12-year-old. Now she was playing with dolls again. She lost her way, and it lasted a long time. Now, we used homeopathic medicines, and to be honest, I don't remember the exact outcome. I believe it helped a little here, a little there. I wish I could have done more. Now, when I look at it, I might have done it a little differently, and I'm going to go over that with you now, how I could have done that differently. But this is not discussed. I've also had people report to me that their child had a local anesthetic in the dentist chair and afterwards had difficulty breathing and was seeing colors and seeing strange things. They were somewhat hallucinating. It was a local anesthetic. And it's unfortunately often dismissed because no doctor wants to believe, or dentist wants to believe, that they were the cause of something so dire as this. So families are very rarely warned. Really, after we think about it, who wants to admit something like this? So I wanted to give you some ideas here. What I would use today. The first thing that I would use before the person goes into surgery is probably one of the most important. And that is, here we go. Everyone's saying hi. It's wonderful to see you all. Carol says, would one always use camphor 200 after allopathic medicines? Well, let's start with that idea. But no, let's make that number 2, okay? Well, let's go back to what would we use before surgery commenced, say the morning of. I would automatically always use Arnica 200, 1 dose. Sometimes we do the night before, but more often than not, if we're going to be extra conservative, we might just use 1 dose before the surgery commences, before the anesthetic is given in the surgery. Now, generally speaking, Arnica is not specific regarding anesthesia, although Arnica's ability is so sweeping, my friends, it often surprises me. But we may not know whether or not the cause of the condition is actually the local, the general, or an injury causing some kind of blood pooling, a hematoma, or something like that. We pretty much know, but we may not know. So we're going to use Arnica. As far as I'm concerned, I would start with Arnica 200, and then and so that they can withstand the shock, the bleeding, the injury from the surgery. Then, if there was indeed something going on, or even if there wasn't, after they got out of the chair, I would indeed give a dose of camphor 200. Just a dose at this point. Just 1 dose is good enough, at least to start. And then we would watch and see what occurs. In other words, are we seeing cognitive decline immediately? Now, I have to say that after surgery, you may not notice because the person could be in pain or they're asleep. You don't know what's going on at that time. But what we do know is, generally speaking, we use phosphorus 200C anytime we see any kind of not coming out of the anesthesia properly. They're spacey. They're not all there. They're in another world. One foot in the reality and another foot still in the anesthetic world. That would be phosphorus. And we would use, say, a 200 for that. I say 200 because that is normally what we use. Then I also want you to be thinking about another medicine, particularly for the elderly. I want you to be thinking about cannabis indicus, especially if there is a loss of awareness or what can often be that they forget things too readily. They're not sure where they are. And I would use that in a 30th potency. But there's one more medicine that we don't talk about very much around surgery and anesthetics, and that's Cali-bromatum. Cali, K-A-L-I, bromatum. And that's for severe memory loss. You wouldn't notice this until the person gets home. And you wouldn't have a conversation with the anesthesiologist, right? When was the last time or you had any surgery where the anesthesiologist hung out with you in your home afterwards when you got home to see how you're doing? Not done. They don't call you. They talk to you beforehand to let you know what they're going to be using. But Cali-bromatum is for severe memory loss, and particularly when a person forgets how to speak. Yes, that can happen. How to speak. They don't know how to speak. They've forgotten how to speak. Or they repeat words over and over again. And the person is restless. Harry asks, what about Carbo-Veg? I love that one, Harry. Carbo-Vegetabilis is great, especially if there is loss of a sense of air hunger, or if there's bloating, and there's also this kind of problem where they're not clear, they're fuzzy-headed, they're kind of a loss of themselves in a way. Yeah, it's indicus, cannabis indicus. People are repeating it so that in case you missed it, friends. You could also use some chemistry detoxing. Well, these are detoxing. So I'm going to tell you that, Tara. That's what this is detoxing. We just don't call it a detoxing protocol. But that's exactly what these medicines are doing. The camphor is detoxing. Arnica can also be. Phosphorus is detoxing. Cali-bromatum, cannabis indicus. And then we also have nux vomica. And that may be that they don't actually lose cognitive ability, but instead they become so ornery, very irritable after surgery. They're demanding. They might have gut issues. I mean, they might have diarrhea or constipation or alternating between the two. They might have sleeplessness. And a lot of sleeplessness is not uncommon after surgery or after these heavy-duty drugs. Then we talk about nux vomica. And in most of these, I would use a 200C. And I would not use them very frequently unless it was needed to be frequently. So how do you know? Well, if you've been using homeopathy for a while, after a while, it does become pretty clear how frequently you should be using them. So if we start with these medicines, say twice a day, and then we tighten it up and say, I don't think we can wait 12 hours before we give this next dose. Let's try it in say 3 hours and see what comes of it. And then after the 3-hour mark, you give the medicine and then you see that it's lasting. Okay, the person's a little bit better, a little more aware, or maybe falls asleep, which is a good thing. And then after an hour, 2 hours, they wake up and now they're kind of back to the way they were. Okay, so if it's been 3 hours, now you might want to go with about every 3 hours. But you're not going to use this forever, my friends, because as you remember, these are not supplements and they're not vitamins. They are medicines, which means that they have to be halted when they're either, number one, no longer needed, because you can see there's a shift and they don't no longer need it. And we're looking for that tipping point as to how often to use it. When they're no longer needed, or they're not doing any good at all. You don't carry on just hoping for the best, at least in most situations. Yes, please, my friends, comment and like. It really helps us get this information out to folks. Are these remedies useful for after a stroke with cognitive loss and memory loss and irritable? These could be considered, but that's not what we're talking about tonight. That is a different conversation. I believe I have written about it. So if you do Joette Calabrese, stroke, etc., you will probably find something. Yeah, a couple people are asking this now. After 3 replacements, my mother did not get feeling back in her legs for 2 hours. I gave her Nux Vomica, and within 5 minutes, she started getting feeling and 10 more minutes standing. Doctor was amazed, and instead of keeping her overnight, he discharged her. Beautiful, Cassandra, beautiful. My father-in-law, 95 years old, recently had to have surgery, and his mild dementia is much worse post-anesthesia. Yes. So you're thinking then of these medicines. Consider it. It can be weeks later. It doesn't have to be the day of or the next or 2 days later. It can be even weeks, even months later. If you can pinpoint that this was the exciting cause, you can start considering. Now, I've written a whole course called Mindful Homeopathy. If you go to Joette's Learning Center and scroll down to Mindful Homeopathy, I talk about dementia a great deal. We've had that in my family. Let's see here. We've got some more comments here. Sometimes it scrolls so quickly. People are telling me where they're from. I love to see it. South Carolina and Australia. Hello, hello, hello. Joette Calabrese. How was your Mother's Day yesterday? It was great. It was great. Thank you. I hope yours was good too. Let's see. Frequent night urination. I'm sure Joette Calabrese. Nocturnal enuresis. Look it up. Joette Calabrese, bladder and frequency. I've written about so many of these subjects, friends, for many years. So you'll find something. All right, let's see what else I've got here to share with you. Let me just tell you that arnica, camphor, phosphorus, cannabis indicus, nux vomica are not the only medicines. I'm giving you kind of the top ones that I'm thinking of off the top of my head. They're most common. These are not protocols. These are to give you an idea, Kali bromatum, to give you some ideas to consider. All right, let's see. Yes, Harry says, think never well since. That's the phrase. Never well since having fallen from that tree. Never well since can't eat dairy anymore, can't eat this, can't eat that. Ever since I had that pneumonia 5 years ago. Well, was it the pneumonia, my friend, or are you sure it wasn't the antibiotic that was used to treat the pneumonia? And so when we know that it could potentially be an antibiotic, then we start working on, obviously, the gut. What about cataract surgery? Does this apply as well? Well, I think what you're asking me is it necessary? Cataracts, I've talked about them. I've talked about them on my blog. I've written about them, what homeopathic medicines to use. Cataracts develop, generally speaking, as a result of insulin problems, so diabetes. And so diet can make a huge change, hopefully early if you catch it early enough. But even if you don't catch it early enough, cutting out all the foods that stimulate an insulin problem. But also Generally, do we have problems with cognitive decline after having had cataract surgery? That might also be your question. And I've never had anyone report that to me, but it doesn't mean it doesn't happen. All of these conditions, any surgical procedure in which they're going to be using a local or general anesthesia can matter. And of course, with cataracts, it's for the elderly. And the elderly are the most vulnerable. Let's see what we've got here. Let's see. Staph aureus is also good after surgery. Well, Staph aureus is specific for a clean incision, for the actual site. Can it be used for other areas? Yes, it can. And you would use arnica perhaps and Staph aureus for the incision so that it doesn't get infected. Happy Mother's Day. Overall perimenopause headaches, Alicia asks about. Well, my friends, oh my goodness, it's already 8:31. I will have to go to my mighties in a moment. Headaches. Headaches are a grand subject, but there is, my friends, anybody have any ideas for perimenopausal headaches? My students are going to know. Does homeopathy cause side effects while trying to heal something? No, I'm dealing with tight pelvic floor muscles and nerve pain. Want to go off an antidepressant that I'm using for nerve pain. Yeah, I can understand why, Amanda. I'm really sorry you're suffering like that. No, there are no side effects to homeopathy. Nope. Dermatologists advise against all homeopathic remedies prior to upcoming lesion removal surgery so as not to increase bleeding. Any input from the mighties is welcome. Well, Stephanie, actually, it's the plastic surgeons who have the best information, and they use Sinech, SINNECH, I think, or is it SINECCH? And it is a wonderful medicine that is homeopathic that plastic surgeons use on a regular basis. So what's happening is these dermatologists are looking up Arnica montana, and they're finding out what it is in the gross form, not in the homeopathic form. So a little bit of knowledge, and I wouldn't even call that knowledge, is dangerous. Yeah. Elizabeth says, here we go, picric acid 200 with belladonna for a headache as an SOS. And Elizabeth, thank you. Sepia to the rescue, 200C once a week in liquid. Yeah, there we go. Howdy from New Zealand. Okay, my friends, I'm going to dash off to my mighties. I'll answer more questions there, and I look forward to seeing you then. Okay. Yes. Okay, friends. Bye, and thank you for joining me. Love it.